Good morning and good evening to our friends in India. I'm Allison D'Ambrosio Bones. I'm the founder of the nonprofit organization Team for Travis, and I'm here to talk about tackling tragedy. And what that means to me is turning compound grief into action. As I mentioned, in 2018, my 4-year-old son Travis died within a matter of hours after first contracting a high fever. It was only through his death that we learned that he was born without a spleen, a rare disease called isolated congenital asplenia. And during that time, since his death, I've founded the 501c3 nonprofit, and we have been involved in advocacy, awareness, and funding the research. Some of our accomplishments were to include funding a new mouse model at UC San Francisco to help understand spleen development and the genetic mutations responsible for the disease. We've also received proclamations from 2 different Arizona governors where I reside, calling attention to asplenia awareness and proclaiming August 25th, Travis's anniversary, as the Team for Travis Asplenia Awareness Day in the state. And earlier this year, we worked with one of our state congressmen to get a passage of a bill to provide for Medicaid coverage of rapid whole genome sequencing for all critically ill children in Arizona's NICU units. So that was one of our biggest accomplishments to date. What we knew about Travis: this kid was active. He was involved in his community as just even a 3-year-old. He was very smart. One of some of his favorite things to do were to solve jigsaw puzzles and compete against both of his grandmothers, solving them quicker than anybody. He could count to 40. He knew his ABCs, and he had a voracious appetite for life. Some of his favorite foods included medium rare steak and fresh raspberries. He was a typical Italian, talking with his hands and twirling pasta like a pro. What we didn't know about Travis was that he was born without his spleen. This rare disease impacts approximately 1 in 300,000 children throughout the world, although the doctors and researchers we're working with say that the prevalence could be as much as 1 in 50,000 due to lack of diagnosis. And it's in fact, ICA is the only known disease in the world that affects a lymphoid organ with no additional developmental abnormalities. Some of the challenges that we have faced, again, are lack of prenatal education. Currently, obstetricians are not looking for the spleen during the routine anatomy scan done at 16 to 20 weeks. Early symptoms are easily overlooked or misdiagnosed, as in Travis's case. We were told he had the flu. Lack of understanding or knowledge among the medical community about the disease, and access to better and expanded rapid whole genome sequencing and newborn screening. Some of the accomplishments we've had in the last 4 years include congressional recognition from Arizona Congresswoman Debbie Lesko, Governor Doug Ducey, and Governor Katie Hobbs presenting us with a Asplenia Awareness Recognition Day, and then funding research. We did our first grant in 2022 in partnership with Uplifting Athletes to co-fund the establishment of a new mouse model at UC San Francisco. And again, as I mentioned, speaking with Congressman Montenegro in Arizona and testifying to the Arizona Senate and House Health and Human Services committees, and also the Senate Appropriations Committee to get the bill passed in Arizona. And here at this wonderful summit, where we look to bridge not only across continents with Indo and US researchers, but also across rare diseases, and find those commonalities among the rare diseases, commonalities among the genetic mutations. And so some of the things that I think can come from this wonderful opportunity is the establishing of new relationships with researchers, finding even more ICA patients and getting them enrolled in genetic testing, and developing an educational campaign for sonographers and also radiation technologists, so that when they're looking at babies in the prenatal period, they can determine if they have a spleen or not. Thank you.